Hey, what's up, everyone? Dr. Nate here. I'm here with my friend Andrew. We're going to talk about scar tissue today and what it is and if it causes pain and all that good stuff. So I think we'll just jump right in.
Yeah, I guess just in general, like I have a lot of scar tissue just through certain things. Fun fact, actually, I worked in a kitchen years ago when I was maybe 16, like one of my first jobs that I ever got. And to this day, I still have scars on my hands from going in, cleaning dishes, and hitting a knife. And I'm just like, I don't know. I'm sure a lot of people out there as well have like scars from injuries, surgeries, whatnot. But to this day, I still have all these like gnarly scars on my hands. And I guess from a PT perspective, like, is there any way to fix that? Is there any way to rehab a scar that is actually like numb, like in more extreme cases? Or is there any treatment to treat like little minor scars like that? What do you know about any scar tissue?
Yeah, so there's different types. So you have scars that form over the skin, right, or on the skin to replace it. And then you have what people often talk about, scar tissue. A lot of people blame pain on scar tissue after like a surgery or an old injury or something like that. And it's essentially kind of disorganized collagen fibers that come together. When tissue is healing, when skin is healing, new fibers are being laid down. And if they're not being laid down in a nice straight fashion like normal skin does, it can form what's called a scar essentially, which is a kind of it's more cross-sectional in the sense of it's not all in a nice alignment. It's more kind of woven together. So it's not quite as pliable, doesn't stretch quite as much as your regular epithelial tissue would.
Is there any way to kind of increase like that maneuverability, or is it just kind of like stuck like that? Like, can you...
I haven't looked at recent data of like how much you could actually improve the pliability of a scar. I know that a lot of people will do like a scar massage. How much that actually helps, I don't know. Aside from just like moving the entire joint or region. Now, if it's not over a joint, like if the skin's not over a joint, then it probably does make sense to do some sort of scar mobilization just to get that tissue moving if it's not used to like stretching that much. But if it's over like a bony surface, it is probably stretching enough just through normal movement, I would think. And again, this is not necessarily my area of expertise in terms of pliability of scars and all that type of stuff. I know that some of my PT colleagues who do work with a lot more post-surgical cases and also who do wound care, they could probably answer that very, very, very well. So, my knowledge on that is out of date.
What do you know about scar tissue in the aspect of like even not like just cuts in general? Like sometimes people say they can get an injury and still get scar tissue development. Like for me, like I used to do gymnastics, and I did this flip a long time ago, and I was going into the foam pit backwards, and it's a double flip, it's a 360 and then a back flip. It's called a full in, and I was doing it into the foam pit, did it a couple times, but one time I just went off axis, and instead of going straight back, I went sideways. Luckily there was a mat there, but I felt myself in the air go sideways, so I opened myself up to stop my rotation for the second flip. And I landed right on my neck, did a little lawn chair where your legs fall forward. And ever since then, I've been noticing like my right side, like my mobility from left to right is just so different. And I can feel like just tightness in anything like that. Is that considered scar tissue, even though I didn't really kind of cut the skin surface?
So you can definitely have additional fibrotic tissue laid down at joints. I would have been interested to see what your range of motion was before, to see if, and to measure it to see if there is like a big difference, because sometimes there is just a normal amount of difference from one side to the other. One side typically will feel more tight than another, depending on a variety of different factors. You can have more scar tissue laid down like underneath the skin. So if you've had like an injury, usually it's after surgery or a pretty traumatic injury that people actually have scar tissue that's under the skin.
Yeah.
And that can lead to less pliability. An example is in like total knee replacements. Sometimes there will be such strong fibrosis that happens that the knee physically cannot extend fully or bend fully because the capsule itself is so stiff, it doesn't allow it to do it. So there are definitely cases where scar tissue
can develop
and cause a lot of problems. Contractures is another thing that comes up.
Okay.
It's pretty common in strokes and other neurological conditions that take place. But scar tissue itself, I think, is blamed on pain quite a bit. Or pain is blamed on scar tissue, and it's not as close a correlate as you would think.
Is there anything like wrong with scar tissue in general?
Not really. It's the normal way that the body tries to heal.
Yeah.
So it's not necessarily something I would worry about too much. And ultimately, like, you're not going to make it go away.
Yeah.
Like, you can't. I mean, you can use like vitamin K and everything on like scars on the external surface to help with that. And of course, like, moving to improve your mobility is important for just, if you want to try to increase your overall mobility and strength.
Personally wise, like, what would you give the viewers today? Like, give them like one last kind of like advice of like, like treatment wise, like, do you have something personally that you would recommend to your patients that have like a excess of scar tissue that kind of bothers them? Was there anything that you would give them? Yeah,
I would say that it may or may not be the scar tissue that's causing the issues. It might be something else. So don't think that you just have to endlessly stretch to try to get rid of it, because that probably won't do it anyways, even if you're trying to. So just stay moving. It's what I'm probably saying every video, stay moving. And that's the best way to improve.
Perfect. Cool. Well, thank you for your time. If you guys have any questions, feel free to reach out to Dr. Nate. Like, comment, subscribe on this video, and you can leave a question below on something that you would like for us to talk about, and we will ensure to do so. So thank you guys for your time, and we'll catch you on the next one.
Cool. See you guys.